Dr. Sajid here again, talking about a topic that we have discussed before, and that is the unnecessary use of medicines in general and antibiotics in particular. We have just celebrated this last week, highlighting this issue in conferences, lectures, and articles in the media. And may I just remind you that antibiotics, although very useful for doctors who have this way of treating serious infections, mostly viral, mostly bacterial, sorry. But we find that there is a lot of unnecessary use, or may I say, abuse of antibiotics. So antibiotics need to be prescribed by a doctor after a specific diagnosis has been made, and not by parents on their own, or grandparents for that matter, or the pharmacist, or somebody's relative. So please make sure that when an antibiotic is given, it has been given by a doctor, properly prescribed in proper doses and for proper duration. Now, why do I keep emphasizing not to use antibiotics? The reason is that it can have side effects. It can cause allergies, of course. It can cause diarrhea. It can cause fungal infection, especially in the mouth, and some skin conditions that are very, very serious, which cause a lot of blisters, not only all over the body, but in the mouth, and the child can become miserable. Similarly, if you use antibiotics too long, then you can have a certain form of diarrhea, which is very difficult to treat, and the child can become very, very sick. Now, don't misunderstand me. This is not only applicable to children, but also to adults. So please use antibiotics very carefully and only after a prescription. Now, another very big reason is that the antibiotics that used to be effective for common infections and conditions in Pakistan and elsewhere in the world have now become what we call resistant to the same antibiotics. That is because we have used them, abused them, they don't work. So I can give you three examples. One is, for example, typhoid, the fever. And typhoid fever, the medicines that we used to use don't work anymore. The antibiotics have to be altered. Sometimes they have to be given intravenously, and sometimes the child has to be hospitalized. Similarly, medicines that used to work for tuberculosis don't work anymore. They're not effective anymore. So we have to turn to newer antibiotics, combinations, sometimes hospitalizations, expensive medicines, longer durations. And the third example I can give you is that of malaria, again, where we used to treat them very simply with the simpler antimalarials that we cannot use anymore because it is becoming resistant. And I can go on and on. A lot of bacterial infections have been subjected to unnecessary antibiotics, and they don't work anymore. So please do not take medicines on your own, and do not take antibiotics, especially on your own. Now, prevention, lastly, would be a better way. We are all familiar with preventive measures such as hand washing, such as keeping distance from somebody who is not well, wearing a mask over the mouth and nose, and of course, immunizations. Immunizations are one big way of preventing infections. So if you can avoid them, you won't get an infection. And if you don't get an infection, you don't have to take an antibiotic. And lastly, we have to be very careful about the food we eat and the water we drink. So again, please try to prevent infections. But if an infection does occur, and if an antibiotic is prescribed, please make sure the condition has been properly diagnosed, has been seen by a doctor, and a specific antibiotic is given for a proper duration, proper timing, and you have to stick to that. So I hope this was useful to you. I will come back for more videos.